Sucralfate is one of the widely used medications for the treatment of duodenal ulcers. It is available as tablets and suspension for oral use. It offers few advantages in treating duodenal ulcers. Sucralfate accelerates the healing of duodenal ulcers. This medication is mainly intended for local action. Therefore, a very small amount of the sucralfate is absorbed from the gastrointestinal tract. This negligible systemic absorption can minimize side effects. It forms a protective barrier on the ulcer. This prevents ulcer progression and increases healing rates. Sucralfate also reduces the activity of pepsin. This helps in controlling gastric pH. It also neutralizes gastric acid to some extent. It can also be used to treat stress ulcers. However, this medication has few limitations. Sucralfate should be used for short-term up to 8 weeks. Recurrence of duodenal ulceration may not be reduced by this medication. This video covers all such important information about sucralfate, like how it works, how it interacts with other medications, what its effect is on glucose levels, and many more. How does it work? Sucralfate forms a protective layer on the ulcer base. It protects the ulcer from acid damage. One of the main approaches for controlling the ulcers and increasing their healing rate is to reduce the attack of acids and bile salts on the ulcer base. Pepsin plays an important role in the development of ulcers. It breaks down the proteins in the stomach, where a mucus barrier is compromised. This results in the loss of gastric proteins that line the stomach, leading to more ulcer formation. A healthy stomach lining is protected by a mucosal layer that actually prevents the pepsin from directly contacting the stomach tissue. But in the people with ulcers, the protective barrier is damaged, which results in the direct action of pepsin. Sucralfate just acts like a barrier between the ulcer and the gastric juice. Damage to the ulcer base can be further increased by the attack of acids and bile salts, and even by the action of pepsin. Sucralfate is made up of a basic aluminum salt of sucrose. It binds to the ulcer base and the proteins on the ulcer surface. Because of this binding, it can form a protective barrier on the ulcer, which can prevent the attack of acid, pepsin, and bile on the ulcer. It also reduces the concentration of pepsin in the stomach. In addition, sucralfate can also neutralize the stomach acid. This prevents further damage and ulcer formation. It also increases the secretion of prostaglandins, which have a protective action on the ulcer formation. Normally, prostaglandins like PGI2 and PGE2 can stimulate the production of mucus, which forms a protective barrier on the ulcer base. Sucralfate can increase the release of prostaglandins and increase the protection. It also binds to epidermal growth factors and tissue growth factors, which also play an important role in the promotion of healing of ulcers. How to take this medication? Sucralfate is available as a tablet at a strength of 1 gram. It's also available as an oral suspension. Each 10 milliliters of suspension contains 1,000 milligrams sucralate. In other words, 1 gram of this medication. For the treatment of duodenal ulcers, this medication can be given at a dose of 1 gram every 6 hours. Sucralfate should be taken on an empty stomach 1 hour before or 2 hours after meals. After a few days, the maintenance dose can be given as 1 gram every 12 hours. It can also be used for an off-label purpose for treating stress ulcers. In this condition, it is used as a prophylactic, where it can prevent further ulcer formation and increase the healing rate. For this purpose, again, it can be given at a dose of 1 gram every 6 hours. The treatment can be continued for up to 4 to 8 weeks. Now, let's see the precautions to be taken while using sucralfate. If you are using antacids, you should not use them along with sucralfate. You should not take antacids within 30 minutes of a sucralfate dose. Sucralfate contains aluminum. With the use of this medication, aluminum absorption may be increased. Even though sucralfate is intended for local action on the gastric ulcers, a small amount of the aluminum may be absorbed into your body. Therefore, with chronic use, aluminum is significantly absorbed, which can affect your kidneys. This is more important in people with chronic renal failure or those people undergoing dialysis. The excretion of aluminum is impaired in people with renal dysfunction. This increases its accumulation, and it reaches a significant level in the body. With high levels of aluminum, there may be a risk of developing anemia and decreasing bone density. Therefore, sucralfate is not suggested for you if you have chronic renal dysfunction. Use of other products containing aluminum, such as aluminum-containing antacids, may also increase the total aluminum levels in the body when taken along with sucralfate. Sucralfate can show significant drug interactions. This medication has a high potential for producing significant interaction with other medications. Therefore, always check whatever you are going to take along with sucralfate, and you should even maintain a sufficient gap in order to avoid these interactions. It mainly interacts with the absorption of a few other medications. It forms a complex and alters gastric pH. That's why it can reduce their absorption and even produce a delay in their action. Therefore, you have to take other medications before taking the sucralfate. It is better to take 2 hours before taking sucralfate. This can minimize the risk of interaction at the absorption phase. Sucralfate can increase your glucose levels slightly. This may not be significant in normal people, but in people with diabetes, this may induce hyperglycemia and complicate the diabetic conditions. Therefore, if you are diabetic, use sucralfate for short periods and whenever it is essential. If you're using a sucralfate tablet, use with caution if you have impaired swallowing or altered cough reflex. Alternatively, you can use oral suspension if you have difficulty swallowing. This medication is mainly intended for local action. However, a very small amount of the sucralfate is absorbed from the gastrointestinal tract. This may not bring serious side effects, but the extent of systemic absorption depends on how you are using it. Taking higher doses or at more frequencies than recommended may result in increased absorption. This may increase aluminum load in your body. Therefore, always use it at recommended doses and frequency. Sucralfate accelerates the healing of duodenal ulcers, but it should be used for the short term, up to 8 weeks. It can also be used to treat stress ulcers for short periods. Even though sucralfate increases the healing rate of duodenal ulcers, the post-healing frequency and severity of the duodenal ulceration are not altered by this medication. Therefore, the recurrence of duodenal ulcers depends on how extensively it was healed and how it is maintained. After healing of ulcers with sucralfate, try to maintain good health and avoid diets that increase ulceration. Now let's see the drug interactions. Sucralfate reduces the extent of absorption of many medications like cimetidine, fluoroquinolone antibiotics, ketoconazole, quinidine, tetracyclines, and theophylline. Their absorption is reduced by sucralfate. It also reduces the absorption of digoxin, a medication used to treat heart failure. Digoxin has a narrow safety margin, and its levels should be properly maintained for better action. Sucralfate reduces its levels in the plasma. This may reduce the efficacy of this medication in improving cardiac output. Another drug is warfarin, which shows a similar interaction with sucralfate. Warfarin is an anticoagulant used to prevent clot formation. Sucralfate reduces the warfarin absorption, decreasing its efficacy. Sucralfate can form a binding with all these drugs. Therefore, they should be given 2 hours before the sucralfate to avoid this interaction. What are the side effects? Constipation is one of the common side effects produced by this medication. Since sucralfate contains aluminum, it can reduce gastric motility and can produce constipation. Other side effects like dry mouth, flatulence, and gastric discomfort can also be observed. It may also reduce digestion. Other side effects like insomnia, vertigo, nausea, and vomiting may be possible. With use of this medication, you may have dizziness and lightheadedness. Even though it produces constipation as a common side effect in a few people, it may also produce diarrhea due to the disturbance in gastric motility. That's all about sucralfate and how to use it. It increases healing rates of duodenal ulcers and strongly binds to the ulcer base, forming a protective layer. However, it should be used for the short term, and a few medications should be avoided when taken simultaneously with sucralfate. That's all, guys. Share your experience and how it works for you in the comment section below. Thanks for watching this video. Have a great day.